today from doctors within Fraser Health expresses very similar concerns to what we've been hearing from people unwilling to go on the record that work on the front lines in Fraser Health over the past few days, saying that they are afraid for their personal safety, for their family's safety, because they don't have enough personal protective equipment. There are shortages of staff. They say the measures put in place for the general public are not sufficient. They want to see social interaction face-to-face limited to people within the same household. Will you give that kind of directive using that language today? And if so, how will you enforce this? Because the doctors have not been willing to go on the record now, but they will be on camera today, and they are frightened.
Yeah, and you know, I talked about this yesterday. All of us are concerned about a new virus, how it affects us. And I think, you know, I said yesterday, I'll say it again. We are all in this together, and we were doing everything that we can to protect our healthcare workers. That's important. And we do have sufficient supplies of personal protective equipment. We do have those in place now, and we will ensure that we have everything that we need as we're going forward with this. I know it's a challenge, and I know many people are concerned. It's the unknown, and we're in that period of time where we're going to see people who were exposed a week, 2 weeks ago becoming ill. And we can't control that. What we can control is what happens from now forward. From when we started this, making sure that we are taking those measures everywhere. And our concerns with healthcare workers is that we're being exposed in the community. Not so much from people who've been in hospital necessarily, because we've only had very few cases in hospital, but we're also at risk in our own homes, in our communities. And that's another reason why it is so incredibly important that we take these social distancing measures, these physical distancing measures across the board in our communities. It protects our healthcare workers, it protects our health system so that we're able to care for people safely in those environments. And it also protects our seniors and elders, which we know are the people who are more differentially affected if they do get sick with this virus.